Hello, it is me, deerz, and today it is injection day, the day in the week in which I take my estrogen shot. I recently switched to self-medicating estrogen injections for a variety of reasons, and I figured, why not make a video going over all of those reasons, because I feel like this is a topic that there's a lot of misinformation, a lot of things people don't really know. I had originally imagined this as just a very short video showing how this works. But in the process of that, just explaining why I'm even doing this, I got caught up and I just wrote like a gigantic script about the state of trans healthcare in the Netherlands. So while writing the script, it just slowly turned into like a deep dive on, the state of trans healthcare in the Netherlands, how people get their hormones and their treatments normally, and, what it looks like when you have no access to any of that. This is just a topic that just isn't really covered on like the English-speaking side of things. So without further ado, let's get into it. Trying to access the medical system in the Netherlands as a trans person is a total nightmare. You might be surprised hearing that, as the Netherlands frequently gets mentioned as one of the safer countries for trans people to live in. But make no mistake that safety is built upon a system of trans assimilation and pathologization, which has its roots deep within our trans care system. As a result, if you don't fit within a certain stereotype or category of trans people, you will face medical discrimination and exclusion from this system if you're not careful enough. I think the state of things here in the Netherlands often gets overlooked because it's still better than a lot of other places. Trans oppression isn't as systemic or downright genocidal as it is in the United States or the UK. Plus, whenever it is talked about on the internet, it's often in Dutch, which isn't accessible to people outside of our country. But while our waiting lists are only 3 years long as opposed to over 5 years in the UK, the fact that there are waiting lists still is one of the many signs of a broken system that doesn't respect the bodily and medical autonomy of the people it's supposed to serve. According to a survey from patient organization Thomson from 2016, at least 26% of trans women and 7% of trans men were ordering hormones from the internet and sharing them with each other. Newspaper Trouw published an article in 2020 in which they asked several gender clinics if they knew how many of their patients had previously self-medicated before. Stepwork, a now defunct clinic, which we'll get to later, estimated that a third of its patients self-medicate, while De Waard estimated about half of their patients does. NOS Stories ran a survey that showed that about 200 out of 700 respondents were considering self-medication or reported already being on it. A majority of respondents across all of these surveys reported experiencing significant mental distress from the long waitlist for official care. This is of course a major reason why self-medication is so popular. These people have to deal with a system that will just put their lives on hold for several years, and to avoid the anguish of having to experience that, they decide to take matters into their own hands. Whenever self-medication gets portrayed in the media, it always gets portrayed as some sort of stopgap, an impulsive and dangerous solution trans people will reach for until they are able to access official care through a gender clinic, which would solve the problem. It portrays these individuals as careless and irrational, yet it never truly paints the systems in question as inherently bad or systemically forcing these individuals down this path. It's not the system that is bad, it's the flood of new patients that it cannot handle, and without it, it would be a good system. But I think there's something that gets massively overlooked here. I propose there is another group of self-medicating trans people that aren't represented here. Those who never even step foot inside of a clinic in the first place. You won't find them on a patient survey because they simply are not a patient anywhere. The usual story that gets portrayed is one in which trans individuals decide to self-medicate due to a lack of official treatment. But I'm willing to bet that there's an even larger group of people who self-medicate simply because the official treatment just sucks. Like, extremely fucking bad. There is a page on Instagram called VU Gender Mistreatment, which serves to catalog the experiences the trans community has of the biggest provider of trans care in the country, the VUMC Gender Clinic located in Amsterdam. The VUMC is one of the few hospitals in the Netherlands that offers gender-confirming surgery alongside psychological assessments and hormone therapy, and has gained what many consider to be a monopoly position as a trans care provider. And what VU Gender Mistreatment brings to light is nothing but extreme bureaucracy, misgendering, medical discrimination, and mistreatment in how they assess gender dysphoria in patients and how they provide medical treatment to them. It's not uncommon for them to delay the diagnostics process if you aren't stereotypically feminine or masculine, or if you have other diagnoses such as autism or BPD that they think conflict with your wish to transition. The VMC still asks patients about how they masturbate and what kind of porn they masturbate to as part of their diagnostics process, alongside many other extremely intimate and invasive questions. This kind of treatment is so common that it's effectively become a meme within the Dutch trans community. So you've decided you'd rather not want to get assessed by the VMC. Thankfully, for just hormone therapy and psychological assessments, you can get referred to a number of smaller gender identity clinics across the country. Many of these gender clinics exist to take away some of the strain from the VMC waitlist. Take for example Psytrance, which doesn't have a waiting list but instead has a permanent patient stop. They open up for new patients once every month at 9 in the morning, unless they don't, but maybe they will next month. Oh, but if you don't send them an email in time when they're open, you're pretty much out of luck anyways. It's effectively just a lottery at this point. Another option is a gender clinic called Stepwork went bankrupt in 2021. An investigation from Zembla published just mere weeks before they closed up reveals that there was a ton of financial mismanagement and a toxic work culture within the company. In the wake of Stepwork's closure, a new party joined the discussion of where Stepwork's remaining patients could be transferred to. That party being gender healthcare, led by a woman named Katarina Anastasia Romanov von Oranje-Nassau, who after a mysterious incident at an airport believes she is the physical reincarnation of William the Silent. A lengthy report from Follow the Money indicates that Anastasia has no experience leading any sort of mental health institution and has a long history of failed business ventures with shady financial constructions. An article from Vice reveals that patients are extremely concerned about the future of gender healthcare and whether they will even be able to receive care at all. They'd like to apply for care elsewhere, but that would mean they have no choice but sit through the waiting list all over again, so they're stuck here for now. Zembla, Follow the Money, and Vice all suggest that companies like Stepwork and Gender Healthcare serve the same purpose of overzealously trying to cash in on the already minuscule market of trans healthcare in the Netherlands. Yes, you heard that right, it's a market now. We're a business opportunity to these people. Also mentioned by Vice is a leftist protest group called Transzorg Nu. Since 2021, they have been organizing protests to call for total decentralization of trans healthcare, to remove psychological assessments as a requirement for hormone therapy and surgeries, and to instate an informed consent model of trans healthcare in the Netherlands. There are now several local decentralized branches of Transzorg Nu across the Netherlands, with various protests being hosted in different cities across the country. But no matter our efforts to hold the state and its institutions accountable for their neglect of the trans community, it seems as though the Dutch government doesn't really want to listen to what we're asking for. Most recently, a law has been proposed that would make it easier to change your birth certificate. But even this was met with a lot of pushback in the Tweede Kamer and the public. An ad campaign popped up with a link to a manifest arguing that this law would endanger cis women and girls and allow men to assault them. The manifest was signed by several anti-trans media personalities and radical feminist lobby groups such as Voorzij. I wonder how they get the funding for a nationwide ad campaign like this. Really makes you think, huh? Over in our parliament, the more Christian and right-leaning parties argued that the new law would rush children into medical transition far too fast, despite this law not having anything to do with that. The argument that it would make it easier for men to assault women was also frequently parroted over from the political climate in the US and the UK, despite the law not affecting access to sex-based spaces in any way, as a birth certificate change is purely administrative. Enter Forum for Democracy, the party who totally aren't fascists despite repeatedly suggesting COVID-19 is a globalist hoax, buddying up with Russia, publicly intimidating journalists, and attempting to build an alternative society with their own currency and schools that would allow people to opt out of the government's leftist cultural Marxist brainwashing. Wow, there's just so much horrible things about these guys already that I completely overlooked the fact that their youth party leader allowed people in their app group to share Nazi memes and photos, and that the politician you're about to see wrote a novel under a pseudonym where he praised the Third Reich. Back to the video. Forum for Democracy, whose leader Thierry Baudet thinks that women need to stop getting abortions and start leaving their jobs to become submissive and breedable trad wives to men in an effort to combat the Great Replacement, obviously cares very deeply about women's rights, which is why they are a firm opponent of the proposed law. They argue that it could put male rapists in women's prisons, something that provably doesn't even happen, which even if it did, this law wouldn't even affect that. They then go on to suggest that transgenderism was invented by transhumanist globalists in order to gain total control over the world's population and their bodies. Yeah, I wish I was kidding. Insane anti-Semitic conspiracy theories aside, they argue that allowing a birth certificate change would rush children into medical transition. In another example of the political discourse from the US and UK trickling down to the rest of the world, they cite Bell versus Tavistock as an example of how we're rushing our kids into treatment that is harmful to them. A case that was widely panned by trans advocacy groups and human rights organizations such as Amnesty International and Liberty. This case has literally been overturned already on the basis that the High Court is not in a position where it can issue guidance on Gillick competency, and the matter should be left up to clinicians and the medical community. But what does this even have to do with changing your birth certificate in the Netherlands? It's still up in the air whether this law is even going to make it through the Tweede Kamer, given how contentious it has been. And the only thing it would do is make it easier to get a birth certificate change. It wouldn't really materially change anything in the lives of trans people, who would then be able to change a single letter on a piece of paper while they're still systemically being denied access to life-saving hormone therapy. Patient organization Transvisie has previously sat around the table with policymakers and healthcare providers, but their calls for an informed consent model have mostly gone unanswered. All the government intends to do is to make our inherently broken system easier to access without ever considering abolishing the system and replacing it with something that actually works for the trans community. But throughout all of this, there has been one care provider who dedicates all her time and effort to helping others mitigate the risks of this system by granting them safe access to HRT. Care coordinator Dina Adrie at Bons and Dr. Adrie van Diemen opened the Trans United Clinic located at De Wallen in Amsterdam. They were granted funding from the local council to set up the clinic with the main goal of reducing trans suicidality by providing trans people with hormone prescriptions on an informed consent basis. This meant that you could access trans healthcare without being required to have a gender dysphoria diagnosis or any lengthy psychological assessments at a gender clinic. Yeah, that's right, informed consent. You thought it didn't exist outside of the US? Well, think again. Literally every general practitioner can prescribe hormones to you, but they just don't want to because they all think it's specialized care that they don't want to deal with. The Trans United Clinic was founded primarily to provide care to the most marginalized groups within the trans community, such as sex workers and people of color. But due to the rising wait lists and lack of adequate care through the gender clinics, they found themselves with hundreds of patients from all over the country who wanted to make use of their services, me included. Since they were only open once a month, you'd have to arrive several hours in advance for your appointment because of how crowded it would get at the clinic. If you were too late, it wasn't even uncommon that you'd have to wait until 2 AM until you could speak to the doctor to get your prescription. If I remember correctly, since 2020, Van Diemen stopped providing care for the clinic and continues to prescribe hormones to existing patients through her private clinic, Elagabalus. She only provides care over email right now. You send her an email asking for a prescription, she sends you a scan of her written prescription in return, which you can then take to your pharmacy. As much as I'm thankful that Van Diemen provides these services to the trans community, there's issues here. Elagabalus only consists of Van Diemen and her assistant who answers all the emails, and they have hundreds if not thousands of patients who they need to provide care for. It's not uncommon for prescriptions to list the wrong dosage or for them to just ignore emails for literal months, causing people to go without their medication. I had an email conversation with the Trans Healthcare Network who indicated that it's not just me who has been having these issues. Van Diemen's care at the moment is very impersonal and hands-off because she just doesn't have the capacity to treat all of her patients. In general, their care can sometimes be so inadequate that you kind of have to rely on DIY medication just to fill in their gaps sometimes. And when there's a gap that they are unable to fill in entirely for whatever reason, well... So here's the situation. I moved cities in 2021. I probably cannot access my old general practitioner since I do not live within their area of operations anymore. I didn't acutely need a general practitioner as I'm generally pretty healthy, but Van Diemen is very hard to reach and I'd much rather try to find a local doctor I can switch to. It is March 2022. I emailed the doctor's office closest to me to see if I can register with them, but in the aftermath of COVID-19 they have a patient stop. In fact, every single doctor's office here has a patient stop. I can't apply anywhere. May 2022, I call my health insurance. They inform me that there is a general wait list in my area for doctor's offices. It could take up to a year of waiting for me to get a spot at a doctor's office, so I get placed on the waiting list. August 2022. I've been on estrogen patches through Van Diemen for a while, but I don't think they're working that well. Other people I see have way better results than I do, so I think my dosage might not work for me. I want to get blood work done to see what my levels are. Van Diemen can't do this herself, but she can send a referral letter to your GP. Problem, I don't have a GP. I asked Van Diemen what to do, and I also request a new prescription. They forget to respond. September 2022. After I send a reminder, Van Diemen's assistant responds, and they have no idea what to do. They suggest I call the local GGD. They ignore my request for a new prescription, so I'm without estrogen once again. I call the GGD. They don't provide services like these. They have no idea why Van Diemen even suggested I give them a call. They suggest I should call my health insurance again. November 2022. I call my health insurance. They inform me that a GP can still provide patiëntenzorg, which is when you get care through a doctor's office without being registered there and you have to pay an extra fee. I email my doctor's office again. They still won't do blood work without a referral since they consider this to be specialized care. But I can't get a referral because I'm not registered with them. They inform me they don't even have space for patiëntenzorg. December 2022. I call the local hospital. They too cannot perform blood work without a referral from Van Diemen. They suggest I should call my health insurance yet again. I call my health insurance. They inform me I'm still registered with my old GP in my previous city. Let's call him Dr. Vern. They suggest I'd make an appointment with him. He's extremely conservative in his approach to healthcare, and I feared he wouldn't provide me with the right care, but I have literally no other choice. I can make an appointment on January the 9th. January the 9th. Me and my ambulatory counselor travel over to my old doctor's office. Dr. Vern says he doesn't understand why I take hormones. He says he knows nothing about the medication I take, but after a quick Google search, he says that it must be making me fat and it is not healthy for me. He does not understand Van Diemen's approach to trans care and thinks she's just fucking around. He initially suggests multiple times that I should just quit the medication and tries referring me to a gender clinic so I can get a psychological assessment there. I came here to get blood work done, remember? He asked me multiple times if I'd ever considered surgery and how I feel about my genitals. These are extremely intimate questions which have nothing to do with blood work and everything to do with his inability to understand why I'm medically transitioning when I don't fit his mental image of what a trans woman is. He finally says he only wants to provide blood work if Van Diemen can send him a written summary of my entire treatment and to explain to him why it is even necessary for me to get this treatment at all. So I'm being denied treatment until Van Diemen accomplishes this, which I fear she won't. January the 10th. I ask Van Diemen if she can provide a written summary to Dr. Vern. She does not respond. January the 25th. It's been 2 weeks. I send her a reminder, and at the time of recording, I still have no response. January the 16th. I order a blood test from bloedwaardentest.nl, a commercial third party that sells blood test kits online. You can get blood drawn at a local doctor's office or hospital with a referral from them, and then the blood samples get sent to their own lab. This sets me back 80 fucking euros. January the 20th. I go to my local health center and get blood drawn. January the 24th. I get my test results back. After 3 years of taking HRT, 1 year of sublingual estrogen, and 2 years of transdermal estrogen applied directly to my skin, my estrogen levels are fucking dog shit. As far as I'm aware, my current estrogen dosage is the highest Van Diemen is allowed to prescribe. I've tried asking them to up my dosage, and as per usual, they just forgot to respond. After discussing my situation with other trans people online, many of whom are active in DIY communities already, even before I got my levels checked, I came to the conclusion that this dosage just wasn't cutting it. I am dead fucking tired of the medical system. I fought for almost a whole year to get access to basic care. Trying to access trans-related care in the Netherlands is almost completely impossible if you're not doing it through a gender clinic. You run into GPs who don't understand why you're not with a specialist. You run into people like Dr. Vern, who appear to be living 40 years in the past when it comes to providing care to the trans community. You'll run into people like Adrie Van Diemen, who sincerely tries her best to mitigate how terrible this system is, but who ultimately also gets bogged down by it and can't provide adequate and personal care. So that's why I'm taking matters into my own hands again, and I will be going over the whole process. This portion of the video is basically going to be unscripted because I don't exactly have a script for how to stick a needle into my body. But yeah, what I'm about to do is not some sort of medical tutorial. I am not a medical professional. I mostly want to do this to just show what the process is like of doing DIY as a trans person in the Netherlands. Because I don't think there's really any video or piece of content out there that just directly shows what it's like. And I feel like this might be information that's gonna be vital to a lot of people in understanding how this whole process works. So in terms of equipment, we've got an injection needle, a draw needle, some alcohol swipes, and of course a vial of estrogen. You know, there's just medical equipment stores on the internet where you can just order this stuff. There's also guides on the internet to just show you exactly what sort of needles you're going to need for performing a subcutaneous injection. As for the estrogen itself, there are of course directories online which point to web shops that sell this stuff. I cannot understate that this has risks. I mean, it's injecting yourself with a fucking needle of estrogen from, well, basically an unknown source. This is going to be risky no matter what. Most of the DIY communities, therefore, they aren't like explicitly trying to promote doing this, or they're not going like, hey, you should totally inject yourself with estrogen, but they're more operating on like a harm reduction basis. They recognize that people are going to do this sort of stuff. So they're like, you know what, we cannot stop these people, but at the very least we can tell them, hey, you should definitely not buy that sort of needle, you need to buy this one, so they don't end up hurting themselves in the process. And there are of course risks, and the main ones of course being, well, how do you find a source for this stuff? Because sometimes they get out of stock, sometimes the source, like the people running it, just disappear for a while. You need to like have a steady supply of this stuff, like you don't want to end up going without it for several weeks or months. If anything, injection-based estrogen does seem to be a better option for that, because this is one vial. I have two of them, the other one I put aside here, and that's two vials. They last for like a year. So like instead of having to mail Van Diemen every 3 months and get no response, right now I've just got my entire estrogen supply covered for an entire year, which is pretty crazy to me just in one go. Then we get on to the second reason why I wanted to switch, the price. This is a lot cheaper. It just really is. For my health insurance and Van Diemen, I would like, I get these System 100 patches, I get Cypro, I get Prog, which is not pictured here. That would cost me about 70 to 80 euros every 3 months for every prescription, which totals to about 280 euros a year. Meanwhile, these two vials in total set me back 50 euros. The injection equipment also cost me about 50 euros, but it's a box. It's like a set of 100 needles and 100 alcohol swipes, so those last for 2 years. For 75 euros, I got my entire supply and all my injection equipment covered for like an entire year. And the third reason why I wanted to switch is mainly just, well, my levels are just too low. I could of course try to switch back to pills, I could try to switch to transdermal gel, or I could just go straight to this, because of all my other frustrations with the trans care system. Generally, since you're injecting it straight to your body, you will get higher levels from it, which in this case is exactly what I want. I guess the fourth reason is that I can do monotherapy with injections now, which is when you inject so much estrogen that it starts blocking your testosterone automatically. Previously, I would take Cypro. This, like, you take this orally, so it goes straight for your liver, which can be very bad for your liver. I think generally in most clinics this is only prescribed like until you get a surgery or an orchiectomy. So that eliminates, you know, the testosterone production from your body. I don't think it's really well known what this does if people are on it permanently, because generally you're supposed to, like, you know, get off of it at some point. Most people who take monotherapy eventually do report just having generally better, more stabilized testosterone levels too, instead of just totally nuking their levels with Cypro or some other anti-androgen. So I think it might as well be time to just actually show the process of injecting this stuff into my body. I guess the first thing to do would be to clean the area where I'm going to be injecting. So I'm gonna take an alcohol swipe and just clean the area, just move it like in circles. I'm not filming this yet, but I'll switch the camera to when I'm actually, you know, going to inject the area. It's just important that it's clean. You can kind of hear it on the microphone. My microphone is very close to the injection area. And then we use the second one to clean the vial. So then it's time to open this up. It's not really gonna be in focus because it's focusing on the the desk right now. Yeah, there's our injection needle. Now, the fill needles, I ordered them separately, so I will have to replace the injection needle with the fill needle. Oh, that, okay. It should be noted that I am not a professional, alright? I'm purely doing this for informative purposes, just to show what this looks like. Heck, I'm even following a guide on the internet over my screen there, just because I don't want to get this wrong on camera, because that would be embarrassing. Alright, so I gotta set it to the amount I need. It's time to insert it into the vial. Actually, I'm gonna just switch this around so you can see better. Okay, so now it's in there. And the guide says insert the air into the vial, so there, push it down. So then you have to hold it upside down and start pulling the plunger back. Yeah, see, now there's medication coming through. Alright, I don't really see any air bubbles, and it is up to 0.1 milliliter. So I'll just go and remove that from the vial. So now it's a matter of switching the needles out to the injection needle. So you just twist that and it comes off. And then this one should just go on there. I'm not sure if I talked about sourcing. I already mentioned there's like directories of web shops that sell estrogen products and stuff like that. Not something I would recommend unless there's just no other way. For injection-based stuff, I mean, there's Mannenkoor, obviously. I've heard they have, like, delivery issues to Europe. I wish I could, like, you know, share some info about one of those, like, websites. But I don't have any, because I just got this from someone I know who knows people, I guess. And that's one thing about trans DIY is that there's generally just a lot of people who have stuff laying around that they will just share around because they all recognize that doing it any other way is generally going to be a bitch, and a lot of people, like me for instance, end up without medication for whatever reason, and they just need, like, they need a stash somewhere just to be able to mitigate that. Like, there are generally just, you know, people who you can ask around and they'll probably know someone who has something laying around that you can use. That's like, you know, that's just a thing that goes around that nobody really speaks about, but it's a thing. Anyways, I think it's now time for the part where I actually turn the camera sideways. How do I put the camera at an angle that's not as unflattering? So now all that's left to do is just grab the skin and grab the needle, the injection needle. It shouldn't go in directly, it should go in at like an angle. And I'm actually surprised at how little pain it does. It just goes in there directly, pretty much. It's still a bit scary, but let's go for it. Yeah, so let's just go for it. Okay, that's... Okay, admittedly that hurt a bit more, but I think that's because I accidentally pricked the skin next to it before inserting it by accident. Yeah, it's bleeding like a little bit, but that's what we got the band-aids for. I'm gonna put the cap back on. Without stabbing myself, hopefully. Like I said, I am far from a medical professional. I'm not gonna pretend I'm very good at injecting myself yet. Right there. Yeah, I think that's pretty much it. I don't really think I have anything else to really say. I haven't really figured out how I'm going to end this, like that was just the end really. I hope if anything this was just an informative watch for you. I think the situation in the Netherlands generally gets overlooked in favor of like everything happening in the US and the UK. So hopefully this video can just serve as an explainer to all the English-speaking communities as to what's happening here. If you live anywhere around this area of the country and you're at all interested in trans mutual aid and support, I have a Discord server for you. You may have seen these stickers around town, maybe not. Either way, you can join using the link there. Link will be in the description as well if you're interested. I may be a little bit idealistic, but my hope is really that we can get like a community going on here, because as of right now, in generally like Northern Limburg, there's not really any organizations really that you can actually go to get help with this sort of stuff. So, you know, maybe we can just do it together, you know? Anyways, I am out of things to say. Thank you very much for watching. I hope to see you in the next one. Or something.